Part of my message to the force is, I believe for well-balanced and functioning soldiers and airmen, we need soldiers and airmen to have the balance between spiritual, physical, and mental health, kind of a three-leg stool. And when they get out of balance, soldiers struggle. We have tremendous amount of resources, professional resources available to our soldiers and airmen for those that need help. And please don't be afraid to ask for that help. Likewise, I think it's important that soldiers and airmen have a relationship with their first line leader. And their first line leaders knows their soldiers and airmen. So that they can understand the trials and tribulations that they may or may not be going through, not only to help with the struggling times, but to also celebrate the positive things that are happening in their life, whether it be the birth of a child, graduation from a college, a promotion in their civilian career as well as their military career. If things get out of balance, don't be afraid to ask for help. Specifically, we're talking today behavioral health more so than other stuff, but if you're having an issue with physical stuff, we have resources for that as well. And ultimately what it leads to is soldiers and airmen who are proud to serve in the Minnesota National Guard and really feel good about what it is that their unit is doing, and the unit is something that they want to continue to be part of.
I think in my perfect world, it would be that the stigma between behavioral health and physical health didn't exist, meaning that a soldier would seek help just as much for their mental health as if they broke their leg, or if they had any other physical injury, or they needed medication for blood pressure, that they would see, or that stigma between those would not exist. I think that would make way for more preventative mental health, where a soldier, upon a first couple weeks of not feeling quite right, would reach out for help at that point rather than waiting until it's a crisis, which is a pattern that we see currently, is that soldiers aren't reaching out until they really are in need of intense support and services.
I think it's it's imperative that you have someone that you can talk to and just talk about anything. So whether that's another family member, whether that's a battle buddy, who in your formation do you have a relationship with that you feel comfortable talking to? And that's why I say it's always people are our most important resource. So squad leaders, take time to get to know your soldiers, take time to get to know your airmen, get to know them, and then hopefully they will have more faith in you and be able to share some of the trials, tribulations that they're going through, so that you can maybe give them a little direction if they need it, or direct them to another resource if they need it. Me personally, I share just about everything with my wife on various deployments. I've had a battle buddy, a peer, and they knew if something was going on in my personal life, and I knew if something was going on in their personal life, so we could kind of look out for one another and be sounding boards and encouragers and cheerleaders during both the good times and the difficult times.
One of the things that I often hear from soldiers is that they don't want to tell people what's going on in their personal life because they feel like they're a burden to other people. What advice or thoughts would you give to that?
I certainly understand why people feel that way, but I would tell you from a leader, I want to know what's going on with the people that I'm working with so I can treat them better. So I know if something isn't going right, there's a reason why it's not going right, and really to help take care of them, whether it's, if they're just disgruntled maybe because they're having a struggle with their relationship with their spouse, giving them some extra time for the maintenance on that relationship, or whatever the case may be.
Can you share a little bit about your experience about when you first came into the military versus now, in terms of how behavioral health is looked at, or the stigma within the military?
I've been in the military 30 years roughly. Had a small break in service there, but when I came in the military, there really wasn't a behavioral health presence in the command. There was in some of the hospitals, but there wasn't the focus that there is on it and the resources available that there are now. The Army and the Air Force and Department of Defense have evolved where they've realized that we need professionals for the health and welfare of the force, and whether that's just like we have physical doctors to work on your physical things if you're injured. We also have behavioral health specialists who work to help with your mental health. There's a balance there, physical, spiritual, and mental, and we need all focus on all three areas to be the successful service member.
Thank you. One of the things that we often hear or have soldiers talk to us about is that in a leadership position, that they don't feel like they're able to get the support or help they need, even though they may refer their soldiers to get that same help or support. What would your words be to those leaders who have that thought process?
I can understand that there may be some reservation from a leader because I think that they have to be strong all the time. And we all have different things that we go through in our life at different times. Sometimes we all need help. And even if it's not a behavioral health specialist, if it's someone else, it could be a chaplain, could be a peer. Like I said, don't be afraid to reach out to people for help. I mean, I differently, but I rely on my subject matter experts to advise and help me make the best decisions for the force. If I'm going through a difficult situation, I would want the input from a behavioral health specialist or a chaplain or other professionals to help me guide me through that problem set.
So one of the patterns that we have seen or heard of is that soldiers don't feel like they can go to their leaders at times. They may feel like that stigma will continue to follow them in their career. They feel like leaders may not understand what's going on with their mental health. What are some general advice or guidelines that you would offer both the soldier who is afraid of reaching out, and then also for the leader who may not quite understand or get what's going on with the soldier?
Yeah. And I would say if you're a soldier that's afraid of reaching out to your command, that's understandable, especially if you're a relatively new soldier or airman. And that's why I think it's such an important relationship that the first line leaders have a relationship with their soldiers and airmen, much like the first line supervisors should have a relationship with the first line leader. So you have that trust in one another, and if you're truly having an issue, use that relationship, use that person to help bridge that gap. What I don't want is us not knowing that someone needed help when we had resources available to help them because they're afraid to come forward. If someone is going through behavioral health assessment, treatment, there is protections for them from the command, which you can elaborate on as far as we walk through that process. Our ultimate goal is to get them healthy and get them back into their unit so they can actively contribute to the Minnesota National Guard and our national defense.
Thank you, General. The AR 40-501 is a regulation that really dictates behavioral health, and it states very clearly that a soldier from initial diagnosis has up to 1 year to begin to get back into a deployable status. So the protections that General's talking about is really under a profile, a temporary profile, which ensures that they're not deployable, they're not going to be in an austere environment, which may increase their behavioral health symptoms, and also allows them to attend appointments, make sure they're getting enough sleep, and really individualize what is needed for them.
I think the military is really a team of teams. On the Army side, you go from the team to the squad to the platoon, and on the air side, you go from the flight to the squadron to the wing. And there's multiple other layers in there, but really it's a team of teams. And this is really about getting soldiers the help that they need before we're in a crisis mode, being able to treat that. Just like when you hurt your knee, you probably go to a doctor and you might be doing physical therapy or maybe surgery so that you don't need a new knee when you're 55 years old. it's the same on the behavioral health side. If we can get you the help that you need, as the problems start to nurture, they don't, maybe hopefully we can correct them at the time and get you the help that you need so that it's not a much bigger issue as we get further down the road.
Thank you, General, for coming today. I really appreciate that we were able to have this conversation and reflect on the future of the Minnesota Army and Air National Guard.
Thank you for your time, and more importantly, thank you for what you do for our soldiers and our airmen. They truly are our most important resource, and I value what you bring to the table for the team. Thanks.